Hello, welcome to my YouTube channel. Welcome to Mirror Interpretation Todorova's page. Thank you for being here. Thank you for liking, sharing, and subscribing. Thank you for being part of my community for languages, linguists, language professions. Thank you guys for being here. Thank you for liking, sharing, and subscribing. Thank you for being part of my community. Last week when I did live, someone mentioned, I think it was a girl, forgive me, I forgot her name. She asked about COVID questionnaire, COVID vaccine, and consent form for COVID or COVID interpreting line. And I decided to create, I have prepared questionnaires related to COVID vaccination. Um, and I did this for Italian clients, so I have approximately more or less the script in English, which I'm gonna share with you, and this is more or less what you need to know when you interpret for people that go to the doctor or go to the pharmacy and they want to receive a COVID vaccine. The course is approximately 1 hour, and here on this 1, 2, 3, I have prepared 4 forms, 4 different ways, or 4 different forms in different states are slightly different about COVID vaccine questionnaire or procedures or consent forms. And I'm gonna start with consent form for Walmart pharmacy or any pharmacy. Let's do it. COVID vaccine questionnaire. Have you had seizures when received vaccine? Have you fainted or felt dizzy? Do you receive any protein treatment? Do you have any seizures or brain disorders or nerve system disorders or seizures in the brain or like the main nervous system, central nervous system brain disorder? Are you pregnant or consider that it's possible for you being pregnant? Do you have a weak immune system? Do you take any steroid treatment? Have you received any other vaccine or a skin test in the last 14 days? Some things interfere with the vaccine. It doesn't matter if we're talking about Moderna or Johnson Johnson, they have side effects, okay? Are you receiving any infusions for weak immune system, cancer, radiation, antiviral, thyroid therapy, or anything for thyroid problems? Do you receive any antibody treatments, transfusion of blood products, anything as a treatment for the immune system, or anticoagulant on antiviral treatment? Okay, this is a question that I didn't understand what is it, but I'm just gonna read it to you. I tried to Google it, I couldn't find it. I personally doesn't know what exactly is that. If you're a medical interpreter and you know what I'm talking about, you can write to all of us what they meant. Do you have history of perjuria, martonli, or perperia? I don't know what is that. Okay. The consent form. So I'm just giving you a different clinics proceedings for the vaccine. I will read the consent form to you. I want you to understand the reason why the consent form includes that is because the vaccine is not safe. Yes, unfortunately, it's not safe, it's not tested. They are testing the vaccine on you. This is my opinion. I am not tested. I just did the COVID test last week traveling back from Mexico, which is negative. Thank you, Lord. But I will read for you the consent form and you create opinions for yourself. I give a consent to Walmart or whatever pharmacy is to administer the medicine I required above. I understand the benefits and the risk from this medicine, and I have been informed. I agree to wait 15 minutes after receiving the vaccine to be observed by the doctor or the pharmacist. I myself release from a responsibility the pharmacy or the Walmart or whatever is it from any obligations, and I release them from any and all liability. All its associates, managers, present and future employees or collaborative or representative of any responsibility related to this vaccine. I allow and I understand that my information will be submitted to the state immune registry. I understand that I will be registered in the registry of the state registration for immunization or people that have received immune. They do this in New York. I don't know if in other states they do it. I'm not sure. I authorize my insurance to pay to the pharmacy or the pharmacy to charge my insurance or request payment for the vaccination. And the part 3, it's related to health questionnaire. I will advise you to check. I have a video related to the health questionnaire somewhere there. Do you have any underlying health problem? Are you a public essential worker? In contact with people, store, hospital, customer care? Do you go to school? You agree, and they have to sign and initiate that. Do you agree to come back in 28 days to receive the second dose? I'm not sure if it's Moderna or Johnson and Johnson. One is one shot, and I think the Moderna is the only shot that goes to the nurses and all that. And the 2 dose, it's more classical for regular people. They have to receive second dose in 28 days. And then they have a screening for questionnaire or health situations. But this is gonna be my second video. So that was the first part of COVID vaccine, consent form to the pharmacy, a health questionnaire or any kind of a health issues that can a patient have before they get the vaccine. Thank you for being here. Thank you for watching, sharing, and subscribing. I have another consent form, number 2, which you can check on the second video. That was just a variation of it. Thank you for being here and have a great day. Bye-bye.